We are here to discuss about skin diseases of physical origin. So physical exposure ranges from direct stimuli and temperature conditions to even irradiation. Firstly, let us discuss about mechanical trauma. Recurrent rubbing or increased pressure that is applied on the skin can result in inflamed skin having a crazy paving pattern or even callosity. This is seen especially in occupations such as the shoulders of sack carriers, the knuckles of masseurs, the fingertips of guitarists and violinists, hands of blacksmiths, etc. The conditions are only of aesthetic nature and are reversible. However, prevention in this case is impossible. Secondly, coming to temperature. Besides the physiological effects of temperature on the body, extremes of temperature can cause specific alterations in the skin. They are on the border of diseases and accidents. However, due to the time characteristics, the severe forms are rather considered accidents at work. The prevention is based on insulation, specific type of clothing, appropriate clothing, and even work organization such as rotation of workers and specified recovery for breaks and shelter. Next, coming to the effect of heat. Sweat stagnation can cause certain itchy rashes, generally known as sweat rashes. Overlapping skin surfaces can become sodden, ending up in intertrigo, which is an infectious inflammation of body folds. Heat and physical exercises may cause heat urticaria, a non-allergic hive. Intense heat can cause burns. The metallurgy sector, bakeries, kitchens, summer outdoor jobs such as agriculture, construction, etc., and deep mining are typical exposure. Coming to cold temperature. The effects of cold to the skin may range from progressive vasoconstriction, which is narrowing of the blood vessels, and Raynaud-like symptoms, which is blanching attack of the fingers, to frostbites. Cold storage and winter outdoor activities, example maintenance construction, are examples of such exposure. Next, coming to ionizing radiation. Ionizing radiation is used widely in medical imaging and therapy, industrial quality inspection, and the sterilization of medicines and foods. Occupational exposure to ionizing radiation include X-ray, usually causes local skin signs such as radiation dermatitis. X-ray and gamma radiation can penetrate deeper and thus harm inner layers than beta radiation, which is absorbed superficially or even by the clothes. As technology is improved and made safer due to consistent occupational safety and health standards, the local radiation burns are very rare nowadays. The skin symptoms after a short high-level exposure to ionizing radiation are termed acute radiodermatitis, whereas the effects of long-term exposure is summarized as chronic radiodermatitis. Their prevention is mainly technical and may include segregation, proper maintenance, accompanied by strict protocols, shielding devices, and personal protective equipment. Coming more specifically to acute radiodermatitis. After a single dose of around 10 grays or more, local redness, swelling, and loss of skin color develops. Nausea and vomiting may be present. After days of latency, the disease may progress with a painful livid inflammation with vesicles and bullas, and necrosis that heals with scar, atrophy, and loss of hair. Coming to chronic radiodermatitis, repeated exposure to smaller doses with a total of 50 to 60 grays causes atrophic indurated plaques, spider veins, even a syndrome termed as poikiloderma. Skin cancer can arise after months or years on the grounds of poikiloderma. Finally, coming to non-ionizing radiation exposure. Concerning occupational skin diseases, workplace exposure to ultraviolet radiation is amongst the most important physical risk factors. Although ultraviolet radiation is necessary for the human body to produce vitamin D, excessive exposure is harmful as it damages the skin and the eyes, causes mutation of the DNA, and suppresses normal immunological responses. Coming to the clinical signs, they depend on the magnitude and the actual wavelength of exposure, and to a lesser extent on the individual factors. Example, darker skin can provide some protein against sunburn. Acute effects of ultraviolet radiation ranges from skin tan and red rash to the various levels of sunburn. Chronic exposure can cause increased pigmentation, premature aging of the skin, development of rough scaly patches and squamous cell cancer, and less frequently, basal cell carcinoma. Skin cancers may be preceded by keratosis and keratocanthoma. It is not thoroughly verified whether occupational exposures has anything to do with the development of melanoma. The findings are contradictory. Subjects of ultraviolet radiation are workers in open air and those exposed to artificial ultraviolet radiation, lasers used in medicine, trade, and certain activities that occur at home. Prevention of occupational skin cancers due to radiation consists of proper occupational safety and health organization and instructions, shields, hats and clothing together with medical surveillance. During medical checkups, keratosis can be discovered for treatment, while workers with verified skin cancers should be removed from exposure. Thank you very much.